people we serve, the communities we serve, are communities desperately in need of the services that we provide. Primary medical care, oral health care, dental care, behavioral health and mental health services, and a wide range of enabling services. 90% of our patients have household incomes under 100% of the poverty level, and approximately 40% are uninsured.
Affinia Healthcare is a comprehensive healthcare organization. We provide ancillary services to assure that our patients have all of the resources that they need to be healthy. Affinia Healthcare sees individuals from all walks of life. So we provide interpretation services at all of our health centers. We provide that through video interpretation, and sometimes it's also necessary to have it in person. So again, with the culture and the variety of people that we serve, it is very important to provide those services so that they also have the best quality health care.
Breaking news tonight, the coronavirus forcing millions more Americans into virtual lockdown.
Doctors urging the world to act now.
Over 75 million people in New York, California, Illinois, and Connecticut ordered to stay at home.
You might want to avoid having any visitors because even if someone doesn't look sick, they could still be carrying the virus.
The COVID-19 pandemic, the public health emergency, is unprecedented. Since 1918, the world has not seen such an event.
We really started hearing more about COVID-19 in late January and February. And I remember getting out the Ebola policy that we had put into place when the Ebola pandemic was starting. We went over PPE, we read it over in a meeting, thinking that surely this won't come to us. And by March, it was here.
In the more under-resourced areas of our community, particularly those that have a majority of individuals who are Black and immigrants, Hispanics, and people from other ethnic minorities, these are the communities that have been most impacted by the effects of COVID-19. There is a higher rate of infection, a higher rate of hospitalization, and a higher rate of death for these communities as compared to the general population.
In the communities we serve, it's particularly daunting. And this is because our patients live in poverty. A large proportion of them have negative social determinants of health. And so our ability to provide testing to them is incredibly important.
And so we tested our first patient at Affinia Healthcare in one of our buildings March 16th, and since then we've ramped up testing and we changed care in our clinics, and I just remember all of that then happening really quickly.
On April 2nd, 2020, we set up the first drive-through COVID-19 testing site in St. Louis in the parking lot of our Biddle Street Health Center. This was in walking distance to the largest homeless shelter in St. Louis and several public housing communities. We were well positioned to serve some of our most vulnerable patients. By the end of the month, we had set up 5 drive-through testing sites across the St. Louis area. Affinia Healthcare had already tested over 1,000 individuals and was chosen as the designated first responder testing provider for the city of St. Louis. But it wasn't easy, and we didn't do it alone. Partner organizations donated hundreds of masks, face shields, meals, and even gourmet popcorn for our dedicated, committed, and hardworking staff. This community support allowed us to go beyond our health centers and test directly in vulnerable communities and COVID-19 hotspots around the St. Louis area. The Missouri Office of Minority Health partnered with Affinia Healthcare to set up mobile testing sites in convenient locations. We tested in schools, churches, community centers, public housing neighborhoods, and even parks.
And they just kept coming.
Today is Monday, July 13th, July 30th, and a beautiful morning, August 20th. We are really seeing a lot of people here today at our South Broadway location, as we typically do for COVID-19 testing through this pandemic at this location. Here we approach the back of the Biddle Health Center. see the line of cars behind me that wrap around 18th Street and go back several blocks. We're providing COVID-19 testing services at Harris-Stowe University. They're drive-up, drive-through services for COVID-19. The line is even bigger than yesterday.
By the end of July, we had tested over 10,000 individuals for the coronavirus, and we were not going to slow down. But we also looked for ways to serve beyond testing. Dr. Melissa Tepe, Vice President and Chief Medical Officer, was selected to serve on the City of St. Louis COVID-19 Task Force, providing a direct voice to advocate for our patients. Affinia Healthcare maintained up-to-date information on emerging trends and decisions throughout the pandemic. Through participation in virtual community town hall panels, we were able to relay that information to our diverse community. We also partnered with food banks and diaper banks to increase our distribution of much-needed goods in our health centers across St. Louis neighborhoods. We also supported the American Red Cross blood drive through this season. Our staff care so much about our patients that they reached into their own pockets during the pandemic and raised $10,000 for the United Way of Greater St. Louis to support services provided by other organizations addressing social determinants of health. Every day, our staff worked with undaunted determination to make sure the most vulnerable people in our community had access to COVID-19 testing, and they did it. In the heat, in the cold, in the rain, and even dancing. It's no surprise they were finally given the long-deserved title of healthcare superheroes. This is what community looks like. It looks like 27,000 tests.
Fortunately, Affinia Healthcare is always ready for the next pandemic. So we have staff who have really been preparing for a situation like this for years. We're Joint Commission certified. That provides us with the framework to provide for the services for a pandemic flu or, again, COVID-19.
This was the first site in North St. Louis County, which again is predominantly African American, to do testing. So it's still up and running. It's fantastic for this community to know that, again, they have access not only to much needed daily care, but they also have so critical COVID-19 testing here in their own backyard.
What was so important for us was, just the strong need to help people, because it could be your mother, it could be your brother, it could be your sister, your friend, your neighbor, anybody who could be affected by COVID-19. What we heard from the community was just how thankful that we were hitting these areas that really were underserved and were not getting COVID testing done. And these were the same areas that, the rates were higher. I'll never forget one of the first sites that we went out to, and it was kind of a dreary day and rainy, and we were out there with our full PPE on. There were cars from a mile away that were lined up to get COVID testing from us, but we were determined to see as many people as we can see.
It's so great to be here at Affinia Health. Here we are at 3930 South Broadway, where in a partnership with Affinia Health, along with the state of Missouri, and the Missouri National Guard, they're doing COVID testing every Tuesday and Wednesday, free COVID testing every Tuesday and Wednesday from 9 a.m. to 5 p.m. So for anyone who feels that they'd like to get a COVID test, this is really the place to be.
As you may know, COVID patients, sometimes almost 40% of them, have no symptoms or mild symptoms. So honestly, probably the most common reaction I get when I call a patient is they were surprised that they were positive. They had no symptoms, they were feeling fine. But then as you talk to them, you'll find out, well, my brother had it, and so I wanted to be tested. Well, an employee at work, a coworker had it as well too, and wanted to be tested. And so I can tell these folks who are asymptomatic, have no symptoms of their illness, and help them limit their potential exposure to other folks in the community.
We wanted to assure that our staff were safe. So one of the most important pieces was the training. The training on proper PPE, as far as wearing gowns, as wearing face masks. That was really the first step because we wanted to assure that our staff were safe. After the safety piece was in place, we did the actual operational piece, determining the logistics of where our locations will be, where the population really needed it. So really looking at the data to determine where the sites need to be operational. And then it's also a lot of partnership. So as far as collaboration, we collaborate with the St. Louis Metropolitan Urban League. So that collaboration piece was really like the final piece to assure that the testing was where it needed to be.
The testing is free to everyone. There's no cost. Anyone can take advantage of this testing. So whether you live in this zip code, you live in Illinois, you live in other parts of the state of Missouri, you can take advantage of this testing today. It's really critical for individuals to take advantage of this testing because we're seeing a resurgence of COVID-19 cases, not only in the city of St. Louis, but across the St. Louis region, the state of Missouri, the United States, and even the world.
It didn't take long. It literally takes maybe like 2 minutes and then you're all out and you get to leave. And now you can find out if you have COVID or not.
We're going to have on the gown something to cover the face, and we're going to have on a mask. And then the gloves, of course, so we have to do the testing. And so we test about 200 or 200. The max I've tested was 200 at a time.
I think COVID-19 testing is very important for several reasons. Number one, it is very hard to stop the spread if you don't know who has it, because they can be asymptomatic, which means having no symptoms and still spread it to others. And that allows the public health departments to contact trace, right? To go back and see who those patients were in contact with.
And you guys are actually in a great location where they're redeveloping and it's very walkable. You guys are in an actual neighborhood and not in like a shopping center where it's hard to get to. People can just walk out from the back door and just get tested, honestly.
Affinia Healthcare was one of the first organizations to provide COVID-19 testing to members of the unhoused community. In collaboration with the City Department of Health, we provided COVID-19 testing to the encampments in downtown St. Louis City.
From mid-March to kind of mid-April, we changed so many things in order to keep people safe and really step up COVID testing and care in the community. And we really saw that first surge, which was scary. We didn't have a lot of medical treatment, so when people got sick, they got really sick, and we saw the mortality rate was pretty high. We also then had the shelter-in-place orders and the masking, and as all of that evolved, then cases started going down. And now I can say, we know more about the virus now. We know that masking does work. We know that social distancing works. We have better treatments once patients are sick and in the hospital. But it's still here. We saw a second surge in the summertime, and we are now in our third surge.
I'm here at Affinia because I wanted to get the COVID test, understanding what's going on in today's society and how the numbers are ballooning in our city as well as our county. And I want to make sure to get in here to be safe because I have an elderly mother, I have young children, and also I do a lot of delivering to senior citizens' homes.
I have long said that Affinia has an amazing team from top to bottom, and we've been bragging quite a bit about Affinia as it relates to COVID testing. You all stepped up almost immediately and filled a significant void in testing of underserved populations.
Okay, it was okay. My experience was okay. I gladly appreciate you all for doing this to keep everyone safe, and I hope everyone come out and be tested.
This is what primary care is about, is making sure people are caring for their health on a regular basis.
For this virus, I would come out to Affinia. They are awesome, nice people. They reassured me that everything was going to be okay, and I have nothing bad about Affinia. I'm glad that they came and they're helping this community.
I would describe them as resilient, exceptional staff, hardworking, and true leaders in the community.
Thank you to Affinia Health, and thank you to the State of Missouri, Department of Health and Human Services, along with the Missouri National Guard, who are really standing up this additional effort.
We consider this to be a really important aspect of our mission in the broader community, to help people during a time that is so unprecedented and so challenging.
My name is Angela Fleming Brown, and I am the Chief Executive Officer of the St. Louis Regional Health Commission. We have had a long history of partnership with Affinia Healthcare that's dated back to when they were named Grace Hill Neighborhood Health Centers. So we are very proud of that partnership. They are a major safety net provider for our St. Louis City and County for those who are uninsured and cannot afford access to health care. They are one of our community health centers that has their doors open regardless of individuals' ability to pay. Through the Regional Health Commission, we operate a program called Gateway to Better Health, which is a coverage program that was designed to be a bridge to healthcare, Affordable Care Act, and Medicaid expansion. Through this program, we serve about 20,000 individuals a year. Affinia Healthcare is our largest provider in that program. They see more than 7,000 patients through the Gateway program that they support. And so we are happy of that partnership for those who are uninsured. We understand that many of our Black and Brown communities lack many of the resources that other communities have, mainly in North City and North County. They typically are low income. They have high chronic diseases that places like Affinia Healthcare, who are located in those communities, their staff are made up of people from the communities that are able to offer assistance to those communities.
Access to primary care is essential for people to receive preventive care and care for chronic diseases, and also screenings for preventable or very treatable kinds of conditions. Life expectancy in the zip code of 63106, which is where we are right now here at our 1717 Battle location, is 18 years less than the life expectancy of people who live in Clayton, which is the zip code 63105. So the care that we provide is really the foundation of the health of families and the community.
The places that struggle mightily. We have some of the highest degrees of poverty, highest challenges of crime and dislocation and housing abandonment and lack of economic opportunity. Our partnership with Affinia really started with, recognizing that this was a community that, quite frankly, not unlike being a food desert early on, was also a doctor desert. There was no place to receive primary care, urgent care health here. Again, folks had nowhere to go, and they wound up going to emergency rooms, which we know is not the place to get your primary care. So once we realized that through, again, a whole lot of data analysis from the Regional Health Commission and the Forsake of All reports, that we started saying, well, who can join us, right? Who can provide, that much needed health services for families living in our community? We wound our way to Affinia, and once that conversation started, it really blossomed into something really fantastic for this community.
Affinia Healthcare's WIC program offers comprehensive WIC services that include nutrition education, breastfeeding support, referrals to community partners, and a nutritious food package that are offered to participants on a monthly basis. Well, WIC has proven to be one of the most successful nutrition programs. 50% of the babies born in the United States receive WIC services. We are the largest WIC provider in St. Louis City and St. Louis County. We are designated as a breastfeeding-friendly WIC agency, and we also received the USDA award of providing exemplary WIC services. Affinia Healthcare offers WIC services at 4 Affinia Healthcare locations, 3 area hospitals, 2 community locations, and 5 local Head Starts to provide great access to WIC services for participants.
Accessible dental care is one of the greatest unmet health needs in the St. Louis region. Affinia Healthcare has partnered with the Missouri School of Dental and Oral Health and A.T. Still University since 2015 at the St. Louis Dental Center, a state-of-the-art 79,000 square foot clinical education facility with 93 dental chairs. Through this unique and highly effective collaboration, affordable and accessible dental care is provided for the St. Louis community by Affinia Healthcare dentists and staff, A.T. Still University, and the Missouri School of Dental and Oral Health, faculty, and dental students.
We have a mobile dental unit that Affinia Healthcare has, and we can travel around the city. And what we're doing is being out here and trying to get better access to some people who maybe have transportation issues, and so that hopefully it's a little closer and they can get the dental care that they need.
Our goal at Affinia Healthcare is really to be a one-stop shop. We want our patients to be able to receive all of the services that they need at one location. And that's because a lot of our patients have barriers, transportation barriers, language barriers. So we want to make sure that they have everything that they need at one stop so that the resources that they need can be offered to them.
The Affinia Healthcare Foundation was founded in 2018 to meet the strategic initiatives of Affinia Healthcare. The mission of the Affinia Healthcare Foundation is to secure the financial resources needed to address unmet healthcare needs in our community. The places where you live should not dictate your life expectancy. Our patients really are living under toxic stress almost, because of the conditions of their lives.
Our mission at Affinia Healthcare is to provide high-quality healthcare and exceptional service while promoting healthy lifestyles. We extend our services into vulnerable communities where the need is great. Generally, poverty is high and average incomes are very low, and health status indicators are not being effectively met. It's just what we do as a community health center in the greater St. Louis region.
In mid to late January, Affinia Healthcare did roll out with the COVID-19 vaccine. Preparation for the vaccine really has been a lot of reading, both from the Center for Disease Control and both Pfizer and Moderna, which are the two vaccines that are currently on the market.
Affinia Healthcare has provided COVID vaccine services at our Biddle location, as well as our Salvation Army Midtown location. We have also done one community event at the Southside Wellness Community Center, where we vaccinated over 280 community members. In order for the staff to prepare to administer the COVID vaccine, they had to complete modules and training from the CDC, as well as educational materials from Vaccines for Children.
We're seeing those patients that are over 65. And many African American, also white, some that don't speak English. So a very diverse group of folks. And what I take away really is the hope that they all come in with.
I just want to give all my thanks. I appreciate everything. Everybody's been very kind. You got a wonderful group here.
It was very quick and it didn't take no time, and it was painless. I think everybody needs to get the vaccine. We all know what happens if you don't get it.
And it's been a very good experience. Everyone should get a shot.
This may mean seeing their grandchildren for the first time in a while. This may mean a little bit of freedom, right, to go out and get groceries, or to even do a new activity that, even if it's still socially distanced and masked, but it gives them just a little reassurance that even if they were in close contact with someone who had COVID, that they may not get sick. They may not be hospitalized or die. We're talking about the group of folks that have been really, really scared, not only to get COVID, but to get really sick from it.
This is a source of great pride, but more importantly, it's a reflection of our mission in the broader community and how important it is to keep our communities safe and healthy during this time.